This video will show a very raw insight into the heart, electrical conduction system, and EKG as understood by a nursing student. This is to benefit nursing students studying the cardiac function and to benefit the creator of this, who needed a visual to aid in understanding. The heart is made up of the right and left atria and the right and left ventricles. There are four valves: the AV valves, or tricuspid and mitral valves, located between the atrium and the ventricles, and the semilunar valves, or pulmonic and aortic valves. The pulmonic valve is between the right atrium and pulmonary artery. The aortic valve is between the left ventricle and aorta. The closure of the valves are what makes the lub-dub sound, or the S1 and S2 sounds. Blood enters the heart from the superior and inferior vena cava and the pulmonic vein. Deoxygenated blood fills the right atrium. Oxygenated blood fills the left atrium. The AV valve opens and blood begins to fill the ventricles. Blood fills by gravity. As blood fills the ventricles, the SA node, or natural pacemaker of the heart, sends an electrical impulse. This impulse travels across the atria from right to left. Filling of the ventricles by gravity is considered to be a passive action. The AV node is stimulated. Blood continues to fill the ventricles. As the electrical impulses from the AV node travels to the bundle of His and to the lower portion of the ventricles, the AV valves close, causing a lub sound, or the S1 heart tone. This signifies ventricular systole is about to begin. The ventricles are now stimulated to contract by the Purkinje fibers. The pulmonic and aortic valves open against the resistance of the contraction. Blood is now moved into the pulmonary artery and aorta. The closure of the semilunar valves occur. This makes a dub sound, or the S2 heart tone. Closure of the semilunar valves signifies ventricular diastole has begun. The semilunar valves close and the cycle begins again. Now we will cover how this electrical conduction corresponds with an EKG. Blood enters the atria. This is the line after the T wave and before the P wave. This is when the atria are filling. This line continues as the atria fill. As they fill, the EKG continues to get closer to the P wave. The start of the electrical stimulation from the SA node is shown by the start of the P wave. As the impulse travels from the right atrium to the left atrium, the width of the P wave grows. This time it takes for the AV node to be stimulated is shown as the PR interval. This is the time it takes for the electrical impulse to move across the atria from the SA node to the AV node. The PR interval lasts from 0.12 to 0.20 seconds wide. It is measured from the beginning of the P wave to the beginning of the R wave. The Q wave is the first negative wave after the P wave. However, it is not always seen. A Q wave can mean the person has had an MI. It is an abnormal wave. As the Purkinje fibers are stimulated, the R wave begins. R waves signifies the electrical conduction of the ventricles. The ventricles contract at the height of the R wave. blood leaves the ventricles, the S wave begins. The T wave shows the heart is depolarizing or relaxing. The T wave is the refractory period. The cycle prepares to begin again, and the cycle continues.